Good evening. Today is July 1st, and today I'll continue to be talking about the coronavirus. So the first piece of news that I'd like to talk about is school. As school districts across the U.S. deliberate whether or not to reopen this fall, the American Academy of Pediatrics has released guidelines strongly recommending that students be physically present in school as much as possible. While the advice may seem to break the trend of the AAP's generally cautious approach to health and safety, but the organization believes there are far more benefits to having students in classrooms than keeping them at home. Research has already showed that forcing remote learning during the pandemic has set students back months and further entrenched racial and economic disparities. This could occur in poor households that perhaps don't have internet or devices, which make them unable to learn online learning and fall back in schoolwork. According to the National Education Reporter for the Times, I think the document really clearly acknowledges what our reporting shows, which is that the risk of catching the coronavirus is not the only risk that children and families face right now. The downsides of not returning to the classrooms go far beyond educational deficits. The group warned of students developing behavioral health issues and having less access to physical activity, socialization, and meal programs, while teachers have fewer opportunities to identify signs of mistreatment or abuse at home. The CDC has advised 6 feet between students' desks, but the AAP calls for just 3 feet, pointing to face coverings and frequent hand washing to lower the risk of infection. The new advice draws on scientists' understanding of the virus, which so far indicates that children rarely become severely ill and are less likely to infect others. There will be cases of COVID-19 in schools even when they make the best efforts. But we have to balance that with the overall health of children, including their mental health. And many children in the United States are starving because they can't go to school, and many get their entire food supply from school. So I think as a student myself, I think reopening fall is definitely good news to us because it gives us more learning, more schoolwork to do, and also with more school we can interact more and be perhaps more mentally healthy. And I think overall, if we can have these guidelines be followed in school, I think with the hand washing and the 3 feet apart or 6 feet apart, I think we can be healthy and educational at the same time. The second thing that I'd like to talk about is that the coronavirus is different in many other viruses in that some people may be spreading the virus to tens of or even hundreds of people, and these people are considered super spreaders, while other people have not shown to be passing the coronavirus on to others. So this just has a strange phenomenon in that a small number of people pass it on to a large number of other people, while most people just keep the virus to themselves essentially and don't spread the virus as much. Understanding why this happens may be extremely crucial to curbing the pandemic, otherwise you're always behind the virus. So I think recent research has shown that this phenomenon might be due to circumstance instead of biology, which means that doctors have observed that the viruses can multiply to bigger numbers inside some people than others. This means that some people become virus chimneys, blasting out clouds of pathogens with each breath. Some people also have more opportunity to become sick, and then essentially they make other people sick as well, such as a bus driver or nursing home worker. A lot of transmission seems to happen in a narrow window of time starting a few days after infection, even before symptoms emerge. So if people aren't around a lot of people during that window, they can't pass it along. There are also certain places that seem to lend themselves to super spreading, such as bars. this could explain the lag that countries have been seeing, in which the virus was detected months ago in perhaps samples in the drain, but the first case showed up weeks later. With this new knowledge, you can help stop the virus from spreading, as if we can understand which situations are super spreaders, then we can come up with smart strategies to stop them from happening, and we can control the pandemic. That's it. Thank you for listening, and I hope you have a good day. Thank you.